Hello, everyone. It's Monday, September the 20th. And over the weekend, we lost another 54 great West Virginians. Our death toll now is 3,424. And I'm going to ask for your prayers again. I'm going to ask that you not let these people feel alone. Don't let them become a number. But our 3,371st death is a 65-year-old male from Raleigh County. Our 3,372nd death is a 75-year-old male from Harrison County. Our 3,373rd death is a 65-year-old male from Cabell County. Our 3,374th death, an 87-year-old female from Lewis County. Our 3,375th death, a 49-year-old female from Mingo County. Our 3,376th death, a 72-year-old female from Putnam County. Our 3,377th death, a 63-year-old female from Mingo County. Our 3,378th death, a 78-year-old female from Fayette County. Our 3,379th death, a 60-year-old female from Cabell County. Our 3,380th death, a 54-year-old male from Kanawha County. Our 3,381st death, a 69-year-old female from Monongahela County. Our 3,382nd death, a 57-year-old male from Jackson County. Our 3,383rd death, a 65-year-old female from Kanawha County. Our 3,384th death is a 96-year-old female from Lewis County. Our 3,385th death is a 59-year-old female from Cabell County. Our 3,386th death is a 70-year-old female from Ritchie County. Our 3,387th death is a 58-year-old male from Ritchie County. Our 3,388th death is a 68-year-old male from Lewis County. Our 3,389th death is a 73-year-old male from Cabell County. Our 3,390th death, a 47-year-old male from Wood County. Our 3,391st death, and please listen, a 23-year-old female from Kanawha County. The 3,392nd death, a 65-year-old female from Kanawha County. Our 3,393rd death, a 77-year-old male from Hancock County. Our 3,394th death, a 51-year-old female from Wood County. Our 3,395th death, a 45-year-old male from Lewis County. Our 3,396th death, an 85-year-old male from Mingo County. Our 3,397th death, an 81-year-old female from Raleigh County. Our 3,398th death, a 68-year-old female from Barber County. Our 3,399th death is a 52-year-old female from Hampshire County. The 3,400th death in West Virginia is a 77-year-old female from Jackson County. Our 3,401st death is a 61-year-old female from Kanawha County. The 3,402nd death is an 82-year-old male from McDowell County. The 3,403rd death is a 76-year-old male from Wayne County. The 3,404th death is a 37-year-old male from Taylor County. 37 years old. So much life. 23-year-old. So much life in front of them. 3,405th death, a 68-year-old male from Wyoming County. And I want to make sure that you heard me. The 37-year-old male was from Taylor County. The 3,406th death is a 41-year-old male from Mineral County. The 3,407th death is a 64-year-old male from Upshur County. The 3,408th death is a 76-year-old male from Kanawha County. The 3,409th death, a 91-year-old female from Hardy County. The 3,410th death, a 58-year-old female from McDowell County. The 3,411th death, a 58-year-old male from Mineral County. The 3,412th death, a 67-year-old female from Cabell County. The 3,413th death, a 68-year-old male from Wood County. The 3,414th death is an 85-year-old male from Jefferson County. The 3,415th death is an 81-year-old male from Hancock County. The 3,416th death is a 54-year-old female from Berkeley County. The 3,417th death is a 60-year-old female from Morgan County. The 3,418th death is a 93-year-old male from Wood County. The 3,419th death, a 69-year-old male from Nicholas County. The 3,420th death, a 74-year-old male from Wyoming County. the 3,421st death of 50-year-old female from Webster County, the 3,422nd death of 61-year-old male from Grant County, the 3,423rd death of 55-year-old female from Jackson County, and the 3,424th death in West Virginia is a 79-year-old male from Raleigh County. It's unbelievable. Unbelievable when you think about it. I keep going back to that mine disaster at Sago. Mine disaster at Sago, I think we lost 11 folks. We had 12 miners trapped. It was the focus of all of our attention for days as we prayed and prayed and prayed that they'd be okay. You know, lots of people trying to help them. 11 of them didn't make it at that time. You know, we just read 54. The other day, last day, I think we were here at 74. You know, and we can stop this. We can stop it if we'll just get vaccinated. Our active cases, and now for news, you know, in regard to really what's going on with this variant or, you know, or this virus. Well, I'll tell you what, before I go here, I'm going to jump back to just this. Okay, we just got through meeting over at the mansion. We had a breakfast, basically a breakfast summit with a lot of folks there. You know, our good general, our coronavirus czar have joined us today. Rob Alsop from WVU, you know, one of the key leaders in WVU, and all the great stuff that they've done was there. Dr. Amjad, Secretary Crouch, a lot of my people, you know, a lot of people that were there, you know, to try to listen and see if they could come up with any and every way that we can help. In all of that, the bottom line to the whole thing is our hospitals are on the verge of being overrun. Now, by overrun, I mean that we could awaken to a situation where we're basically rationing care. Now, we're not there right at this moment, but we should all realize that we are now at a point in time where we are reaching a crisis, or we're at a crisis. Now, with that being said, just stay with me just 1 second and listen to me. We have now created another branch. We called Saving Our Wisdom at one time. You know, Jordan Dameron came up with this name and given a lot of credit and everything. Now we need to look at Saving Our Care. Saving Our Care is our hospitals and our nursing homes. They are absolutely getting ready or at the peak of this and being tasked to the limit. And in many situations, maybe nowhere to turn. Financially, if they eliminate elective surgeries, you know, whether they be the same day surgery or they're an overnight surgery, they are really going to destroy the economics of the hospital if they eliminate those. With all that, we have got to step in, and we're going to do that exactly right now. We've created a task force that's going to review reimbursements to these hospitals, but we have got to save our hospitals for our people as well as our nursing homes. And we've got to move, and we've got to move right now. From the standpoint, the number one problem that I gather from everyone is staffing. So from the standpoint of bringing in contract staffing or whatever it may be that you need, that you have to do, Dr. Marsh just said just a minute ago, if you elect to move same-day surgeries and take that personnel that is working that and put them into the hospital to taking care of folks and everything, we will review and we will absolutely reimburse those dollars to you, those lost revenues. We have got to do that, and we have the dollars available to us, and we will absolutely move to do whatever we have got to do to make sure that we continue to provide care for all of our people and we get through this. Now, here's what we believe. We believe that we're right sitting on the peak. In fact, General Hoyer, in a braggadocious way, said that he picked this day. Well, he picked the 20th of the month. That's when we would reach our peak. We think that we're right in that window right now. And as we're in that window, we will decline in active cases. Today, we went down in active cases 8,200. We will see that decline in active cases as we move those to recovered very, very, very quickly if this follows what has happened everywhere else. But what will trail? What will trail? Let's say we're still really a week away and the good general was a little bit off in his date. Let's say we move just a little bit more. Let's say we don't move more. Then just think what will trail. What will trail are hospitalizations, more people in the ICU units, more people on ventilators. What will trail is more people dying. And so what we have got to do is move now. And move now in what we hope is a 4 to 6 month reimbursement program for our hospitals and our nursing homes, that they can continue to thrive and do well, and we can underwrite. Basically, that's just it. Underwrite expenses that they would have, and we've got dollars available to us to be able to do that. And if we get in a situation to where we have exhausted all those dollars, we'll surely call the legislature back in and get approval from the legislature, because I know with all in them, they would be all on board as well. So the long and short of the whole thing is we have got to avoid rationing. So we're implementing saving our care right now for the next really 3 to 4 weeks, but it could be more like the next 4 to 6 weeks. I can't see that, no matter what you wrote. But nevertheless, we will have constant 24/7 monitoring and communications with all of our hospitals and all of our nursing homes. And absolutely what we want back is feedback from you on how we can help with staffing assistance, how we can help with financial issues, and how we can get you through this window. It is really critical that we move right now. And that's what we've done. That's what we've done all along. I've surrounded myself with experts beyond belief. They're the best of the best. We just got through a wonderful meeting and everything, a lot of really great ideas and everything. And so now I want to move from that. I want to move to another great thing that's happening in West Virginia right now, and that's what's happened at WVU. Rob Alsop is with us, and Rob's going to talk to us, and then we're going to show you some graphs and everything about what they're doing. And then we're going, after that, I'll go through the rest of the numbers, and then we'll defer to Dr. Marsh and General Hoyer. But in all of this, I keep going back to one thing. You'll see from Rob speaking in just a second what an incredible success story, and you really are going to be stunned with these vaccination rates. How these kids have stepped up at WVU with the leadership, just continued to, pump information to them and educate them even more. Rob said earlier today, WVU is a mini city, and it is 24,000 folks that are mingling together all the time. We saw an incredible football game on Saturday. Baby Dog did exactly what she should do when she flipped a coin. We stacked the deck that WVU would win the coin flip, and they won it. And so from that, I'll pass to Rob, and then we're going to show you some wonderful graphs and some things that he's done there, and the folks at WVU, and I congratulate you.
Well, thank you, Governor. And yes, we won the coin toss and we won the game, so Baby Dog and you are welcome anytime to games in Morgantown. And thank you for the opportunity to be here and talk through these issues. When we first learned that the vaccines would be available and that they were, more than 95% effective, one of the things that you did and we followed in was to quickly get the infrastructure in place to start getting shots in arms. And it seems like a long time ago, but we started talking about that. We've got to get shots in arms, and we've got to convince people to do it. And so we followed through with that, talking to our campus continually through the spring and the summer. And we set some goals. Initially, we wanted to get to 70%, and folks didn't think we would get there. Then when Delta came along, we said, well, we need to get to 85%, and let's see where we can get to see if we can reduce the spread of COVID-19. And so we continued to talk. We do not have a vaccine mandate. We have required masks in our classroom on a temporary basis and indoors in some instances. What we really wanted to do to convince folks that vaccines were the right thing to do, not only for yourself, but for the community that we all care for. And so we went to work on that, and over the summer, numbers slowly started to climb. We were really worried about a big spike when we got back on campus if we didn't have our vaccination rates in Morgantown at a certain level. And so today, on our Morgantown campus, 78% of our students in Morgantown have been vaccinated. 74% of our faculty and staff have been vaccinated. And our faculty, they're almost 93% vaccinated. Our Greek students have led by example, up over 80%. Our students at our residence halls, almost 79%, and our professional students, 92.4%. What we told you, or what we've heard from the governor and from our health experts, is that if you could get up around that 80% threshold with the natural immunity that's out there as well, that you could slow the spread of COVID-19. And what we've seen is that those vaccines do work. And so we took a quick comparison of where our isolation numbers were compared to last year. We had half as many kids on campus. More than half of our classes were online, and still at this point we had almost 450 kids at our peak who were positive on our campus. This year, we haven't touched over 150 with twice as many students on campus and a lot more activities. The curve, the spike that we saw last year, we just didn't see this year, and it's in huge part to that vaccination rate. Same thing with our quarantine numbers. We had almost, or actually a little bit over 1,000 kids in quarantine as we moved into September last year. Right now, we're less than 200. And so the fact that we're up close to 80% vaccinated on our Morgantown campus, and we've worked together to talk about when we need to wear masks and move, Governor, as we've talked about, getting shots in arms makes a difference. We've seen it, and it's really a testament to our employees and our students that they've taken your call and our work under your leadership to tell them the importance of vaccinations and what it can mean. And so we hope to continue this. We hope to get those rates up towards 85% and be leaders for the state that we need to do. And we're grateful that our students have listened. And again, just to say, these vaccines work, Governor.
Well, I don't know how you could not listen to that. I mean, it's testimonials, and it's a success story that is truly great to be a Mountaineer. A great day to be a Mountaineer, you know, and so with that, you know, I would just say this, you know, to Rob Alsop, Gordon Gee, Albert Wright, all the leadership that has really put in all the licks, and surely Dr. Clay Marsh and General Hoyer, and on and on and on. What a job. What a job. Almost 80%, or right at 80% of the entire WVU community is vaccinated. And with all of that, they have seen their numbers just straight down as far as the number quarantined and on and on. The graphs are, I mean, one thing that absolute mathematics will never do, mathematics and numbers don't lie very often, do they? And really and truly, when it really boils right down to it, it's showing us right there a success story like no one can imagine. You know, at that ball game, I can't tell you the number of kids, and of course, you know, I love kids. And the number of kids that came up and they wanted to talk and they wanted to see Baby Dog or whatever it may be. And they were just cheering like crazy, and they surely didn't have to be wearing their mask, and they weren't. They enjoyed an incredible day, an incredible win by our football team, and an incredible day in West Virginia. Absolutely, that's all there is to it. And they do it because absolutely the numbers work. And so, Rob, thank you. I mean it. Thank you from the bottom of my heart. Great job. Great, great, great job. Let me go back and read these numbers now and get through them. I'll get through them as quickly as I possibly can. But we've got 21,490 people that are active cases now. We've had 1,300 new positive cases in the last 24 hours. That has really gone down. You know, we were at 1,700 or whatever the number was and everything, and we just drifted down for over the weekend and everything. It is showing us every sign that we're sitting on the peak. I hate like crazy that it is coming on the 20th of September. If it could have missed it just a day or two, we wouldn't have had to listen to General Hoyer about this forever. But nevertheless, we'll take it. We'll take it, and it's going down. That's great. Our daily positivity rate is 10.4. Our cumulative rate is at 5.69. We have recovered cases of almost 200,000. We have 955 people hospitalized in West Virginia. You know, it is really, really high, but it is 2 less than it was the last time I was with you. So we were at a peak at 957. If we'll stay here and drift down, that's good. 292 people that are in the ICU unit, all-time record. 164 on ventilators. We had 167 before. We're 3 down there. We have 43 of our counties are red. 9 more of them are orange. We have 88 school outbreaks in 34 counties. 804 kids have this now. 53 counties have a mask mandate. You know, everybody knows that the overwhelming percentage of the folks that are hospitalized are unvaccinated. The numbers we were talking about that over there. The numbers of deaths are, honestly, if you're vaccinated, the chances of you dying, you are almost as well protected as walking out through the middle of the grounds on the Capitol grounds and a meteorite hitting you. You know, absolutely, you know, if you will just get vaccinated, you can't imagine the protection level that you'll have. Now, it's not quite as high as or as low as a meteorite hitting you, but it is incredibly low when you think that we've had vaccinated in this state 1,100,000 and some thousand folks, and the number of people that have died that have been fully vaccinated is just such a small fraction of that. It's unbelievable. 65 and older, if you feel at least a bit bad, go get tested. The antibodies can save your life, and if you're in a big crowd, really, really consider the masks because they do work. They do work to some degree, and absolutely we're not putting mandates on people, but literally consider it. The booster shots, we need to clean up what we said on Friday. Basically, I was slipped a note, you know, that said the FDA had just voted against all the booster shots. Well, that's really not true. You know, really what happened, and then Dr. Marsh, you know, kind of followed suit with the same thing because that's the information we had. But that's not really the way it is. The way it really is if you're 65 and older, the FDA voted for you to approve for you to get your booster shot. Now, and you know, with those that are of some level of high risk of any severe illness, they also, you know, basically said just this, that I guess those under 65, they're not approving that booster. Is that correct at this time? So what we want to do is we want to take another step forward, and you'll hear about this from Dr. Marsh in just a few minutes, but we want to do an extensive study of the antibodies of those that are between 50 and 65. If you're 65 and you have some kind of issue and everything, you can go on and get your booster shot, and we would recommend you do that. But if you're 50 to 65, we need to get you in and test those antibodies to where we can start plugging in information and everything to where we can absolutely be making cases to be able to get you a booster shot as well. So we're ready to go. We'll be standing there ready to put shots in arms as we've done before, and we've led the nation in doing so, and all that's been great. And they're going to talk to you about all the different antibody stuff in just a few minutes. You know, as far as do it for baby dog stuff, well, you've heard enough about baby dog today. We'll continue to do the raffling and everything, and we continue to make headway as far as getting shots in people's arms, but we need to just get more and more and more. Help me in any way and every way we can to get these vaccination rates up higher and higher. And I want to caution you about one thing real quick. I've got wind that maybe, just maybe, that our numbers are not matching exactly with the CDC, and we will be coming back to you on Wednesday, and there may be some little tweaks and and adjustments to our numbers. Nevertheless, the message ought to be exactly the same. Nothing changes. The percentage of unvaccinated is very, very high in our hospitals. The percentage of vaccinated is very low. The percentage of deaths from those that are vaccinated is almost nil. Absolutely, we need to continue to preach the same message. It's the only tool in the toolbox. It's the only bullet in the gun. We've got to get vaccinated. You know, from the standpoint of vaccine eligibility, we're going to talk to you more on Wednesday about this, but I think Pfizer is right on the verge or has gotten approved. And if they've gotten approved from the standpoint, I think from 5 to 12, that age, we're going to talk to you about how to get their kids vaccinated. And you know, I'm told now that they're not approved yet, but they're right on the verge of getting that approval, and what we can do to be ready to be able to get more and more of our young kids vaccinated. I've told you about our grand families, the $150 voucher, and our grand families have got 19,000 kids in them, and we need those kids vaccinated, so help us and take advantage of that voucher. All the COVID information's up on my website. The get tested stuff and everything's all free. We thank Frith and we thank Walgreens for all the work that they've done. We've got 82 outbreaks in our long-term care facilities, 4 outbreaks in our churches in 4 counties, Braxton, Monroe, Raleigh, and Wayne. We have 228 inmate cases in West Virginia right now at 20 facilities and 66 staff cases at 24 facilities. We're all hoping and praying that we're at the peak, but we've got to absolutely assure ourselves that we have hospital care for all of our people, that we can get through the peak. Now, if you just step back and think about this, just think, what are we going to do if we totally overrun our hospitals? You know, whether it be in the next few days, in the next few weeks, or any time. Absolutely, our number one responsibility has been save lives, but our number 2 responsibility right behind it has been to save our care. So our project that we're embarking upon today, saving our care, is doing just that. We're going to step up from the state level and dollars that we have that we need to put into these facilities, whether it be our hospitals or nursing homes, to be able to prop them up at this time when we need them more than anything. That's what we got to do. That's what we got to do. Because these people absolutely don't need to be turning people away that are having heart attacks or whatever it may be, because they don't have any room at the end. At the end of the day, we have absolutely got to prop these people up and help them. And that's what we'll do. We've got the dollars to do it. We're moving that way right now. So I encourage you about giving blood, like I said, and that is all that I have for right now. Thank you all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you and good afternoon. In support of what the governor has suggested as save our health, is that our
Save our care.
Save our care. Save our care is really, really important. So we have seen the great job that President Gee and Vice President Alsop and others at West Virginia University have done, and the great impact of having a more fully vaccinated community, where we have seen the really tremendous reduction in new cases and isolations and quarantines. And that is particularly important because, as the governor said, we are at a point that is really quite historic related to how full our hospitals are of very, very ill people. We have seen almost daily records here in the last week or so of hospitalizations, ICU admissions, and people on mechanical ventilators. And what we're seeing now is the number of deaths in West Virginia is starting to increase every time we have a new press briefing. And per the general's prediction capabilities, we do believe that the peak of the new cases is either here today or very quickly upcoming. But we also know when we look at other places that have had problems with COVID infections, particularly with the Delta variant, we know that hospitalizations will continue to increase most likely even after those new cases, perhaps for 2 to 4 to 6 weeks, as the governor has suggested. So looking at how we can support the maintenance and the operating capacity of our hospitals is so important. Our West Virginia Hospital Association and our hospital leadership have done such a great job, but I think the governor's commitment to support those facilities, so not only can we take care of all people with COVID-19, but as the governor said, it's also important that we have our hospital beds available for people with strokes, heart attacks, motor vehicle accidents, and bad infections, because when hospitals get overwhelmed, then those elements start to suffer too. And we've seen 2 states in the country, Idaho and Alaska, that have rationed care. And we certainly, as a leadership group, and certainly under the governor's direction, we are committed that that will not happen here in West Virginia. We have already started to make some provisions. The hospitals are reporting on a daily basis now related to their status, what level of care they're offering. We also, and General Hoyer may further elucidate this, but we're starting to centralize our monoclonal antibody ordering and implementation so that we can infuse people with these antibodies on any day, because we know that people that are at highest risk of having severe COVID problems can get the monoclonal antibodies early and significantly reduce that risk. And also we have worked now under the leadership of Dr. Tara Halsey and the State Nursing Board to look at making nursing students, nursing faculty, and retired nurses have the ability to be able to volunteer to improve and increase our staffing. And so as we start to look at where we are today, we know that the boosters, as the governor said, have been recommended for approval by the Food and Drug Administration for people over 65 and people at risk of severe disease. The CDC, the Centers for Disease Control, and their advisory committee, the Advisory Committee on Immunization Practices, have to vote next, and they will clarify those groups of people. But enhancing our ability to look at antibodies in those 50 to 65-year-old people that may not be included in that first booster opportunity for people 6 months previous to their vaccine, then that will be helpful, because some of these people might fit in our immunocompromised group if their antibody levels are not measurable or very low. Then we want to make sure that we have that ability to re-immunize anybody who fits any category, because we know from Israel and other countries that being able to do that 3rd dose or a booster dose is really important to increase the number of antibodies that fight COVID-19. So we are well positioned today under the governor's leadership to be able to continue to provide full services to all West Virginians, no matter what their illness is. But we also know that we are operating on a very fragile precipice, where if we don't pay a lot of attention and support our hospitals and nursing homes and healthcare providers, then we may not have that luxury in the future. So West Virginia, it's really important for you to go get vaccinated if you haven't been vaccinated. Be really careful. Don't overwhelm the emergency rooms of our hospitals with problems that you can contact your primary care provider or your primary clinic to be able to get help for. And working together, pulling the rope together, we will make it through this as we have so far during the pandemic. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Our governor always likes to put me on the spot, make sure I'm on top of my game. But there's a group of data scientists who are working diligently every day on our numbers, who are behind the analytics of where we believe we're at today. And I think we're close to that spot today, and hopefully that will help. But what people need to understand, part of what the governor pointed out, is that our historic data shows us, not just in West Virginia, but nationally, that after you hit that peak of cases, you still have somewhere between 2 to 4 and maybe even 6 weeks of hospitalization increase and death increases. So we've got to be cognizant of that fact. We continue to make progress with our distribution process for the monoclonal antibodies. More have signed up to be a part of that. There's a larger meeting today at 3 o'clock with our county partnership teams to go through that. A lot of discussion over the weekend with hospitals. Hospitals are very appreciative and working to cross-level the amount of antibodies that we currently get in the state, which is about 1,440 doses. We have not exceeded that level in the past, but we believe this week with this greater distribution process that we will start to exceed that, and we will work with the federal government to reach out and get more. I want to just reinforce, last week the governor had Linda Lanier, her son Joe, still in the hospital after several weeks of fighting COVID. But Linda did report to me that the day that she came on to the press conference, within a handful of hours, several people had called her and told her that they had gone out to seek a vaccine that day. So we need to pay attention to the people who have suffered from this and learn from that. They are reaching out to us and telling us it's really important. As the governor pointed out, we can stop this, get vaccinated. And just to put the numbers in a little bit different perspective, of the 3,424 people who have died, only 118 have been breakthrough. Our governor, in just a 2-day period, read more than that number of West Virginians who have died from this terrible disease. So please pay attention to what the governor is telling us. Please go out and get vaccinated, and please take care of your family. Thank you.
All right, thank you, sir. Dr. Inamjad, our State Health Officer, and Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News. So I have a few questions about our new Save Our Care initiative. So could someone tell us exactly what expenses will qualify? Is this just deferring elective procedures and contract nursing specifically? Are those the only two things that will count? Who will be reviewing the reimbursement applications and approving them? And where exactly is the money we're going to be using coming from? Is this federal dollars? Thank you.
Well, Charles, I can answer the tail end. You know, they're federal dollars through and through. You know, they're either leftover CARES money or they're the American Rescue Plan money. You know, but they'll be federal dollars, and then all the rest of it. I think Dr. Marsh is going to have to tell you, you know, how you qualify, who's going to be approving it, and looking at who's going to be contacting and all that stuff. So the whole approval process, but nevertheless, Dr. Marsh.
Thank you, Charles, and thank you, Governor. So we will work closely with the Hospital Association and the hospitals and direct what kind of expenses can be reimbursed. And we've talked about issues like staffing, loss of revenue, or other expenses. And those would be submitted through the DHHR and then through the governor's office for funding. But we will have a more complete overview of that in the upcoming briefings.
All right, thank you, Charles. Next, we'll go to David Beard with the Dominion Post.
Hi, I'd like to clarify just a couple things I didn't understand from what's been said. One is the antibody testing for ages 50 to 65. How do you go about doing that? And do you have to be 6 months out? And then the other is on Save Our Care. It sounds like the reimbursements would be for hospitals that have to ration care, like cutting back day surgeries and whatnot. So I'm not sure how that avoids rationing. Maybe I didn't understand what you were trying to say about that. Thanks.
Well, David, first of all, I'm gonna pass to General Hoyer. General Hoyer, can either answer or pass to someone else. But David, let me say this: we're going to make every effort in the world that we're not at rationing care. I mean, that's what this is really all about. We are absolutely. That's why we have met over and over and over. That's why we have moved today. Because God forbid we don't want to get in that situation where we're rationing care. Now, from the standpoint of a hospital, that could absolutely get overrun and not be in any other position because of the economics of the hospital, or staffing or whatever things that maybe we can assist and help with. We want to be able to do that. But this is not. The hospital that qualifies is the one that can't do anything else at all and is down there rationing care out and everything right now. And the only way they can even halfway do anything is cut back all their surgeries and whatever like that. This is not that. God forbid, we don't want to get to that. But General Hoyer.
Yes, sir. Thank you, Governor. So, David, related to the antibody piece, part of what we have work to shift now or we'll look at is with the 65 and above approval for boosters, we believe it's going to be important to then focus on 50 to 64, knowing that West Virginia's historic numbers throughout this pandemic, 97% of the people over age 50 were both either those that were hospitalized or those that have died. Now, those numbers are changing because of the Delta variant, but that's still the preponderance of the numbers. So thus the reason for the focus. Our first approach is on nursing homes and assisted living facilities. Over 800 have been tested, and more are being done this week. A group of 100 baseline personnel have already been completed, so we'll continue to focus on that. And again, we've also, as we do these studies, have to be cognizant of the staffing requirements. It requires phlebotomists to go out and draw blood. Those are people that are also needed in hospitals related to the issues we currently have. So our nursing homes are also working with outbreaks, so we have to balance all of those things to make sure we get the studies done and not disrupt flow. Thank you.
All right, thank you, David. Next to Paul Mullen with WCBC.
I'm halfway tempted to ask General Hoyer for tonight's winning lottery numbers. The real question, though, is I want to start off the week on a positive note. I've been noticing that Tucker County has done very well. If you look at the map, they have been in the green recently. They're now in the yellow. They do have a little bit higher infection rate, but I also noticed on Secretary Crouch's map that they have a very comparatively high vaccination rate. Is the team seeing that too? And I don't know, can you give Tucker County a bonus, Governor? Thank you.
Tucker County needs a bonus, and everything, but the bottom line is just this. It's just what we did with just a second ago with Rob Alsop, our Vice President. Think about the whole thing just a second. That when you're vaccinated, the numbers come down. It's just as simple as that. But Dr. Amjad, you can answer the rest of this, please.
Tucker County, I was looking at their map as well, and they are doing well, Paul, and counties like that have higher vaccination rates and are doing well in testing, we want other counties to follow them, and I think they do need props and accolades. So I think other counties like that should be recognized, and I hope other counties can follow them. So I don't know what else to say, but congratulations to them. Thanks.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. I would just like an update on what the National Guard might be doing right now to alleviate some of our COVID concerns, and if you all are looking at potentially involving them more.
Jane, I can tell you this, that we wouldn't have time to discuss what the National Guard's doing right now in any way. Absolutely, those people, and I've said it 1,000 times, I give all kinds of accolades to Tucker County, but I want to give all kinds of accolades and 4 cherries on the top to the National Guard. I mean, what they have done through this whole thing is unbelievable. And we're led now by a great general. We were led by a great general as well. And he's going to tell you the rest of it anyway.
So June, the National Guard still continues to work support for testing, for delivery of vaccines, for supporting the PPE mission, all of those missions that were being done before. One of the things that we've had to work closely on is there's a tendency to say, well, we'll just bring National Guardsmen in who are medical experts to go to the hospitals, but we've got to understand 85% of the men and women in the National Guard are part-time. They have other jobs. So all we would be doing would be shuffling the deck chairs, moving them from one hospital or one clinical setting to another. So we don't have the luxury of just pulling National Guard medical personnel in to address our hospital needs. But they continue to have over 650 National Guardsmen on duty and are scheduled to be funded through the end of this fiscal year to stay on and support the effort. And as the governor said, as the former Adjutant General, I can't be more proud of the men and women of the National Guard and their families for the sacrifices that they're making. Thank you.
All right, thank you, June. Next to Glenn Kittle with WVVA.
Thank you, Governor, Justice, and team. So as you probably heard earlier today, Pfizer recently got through that second of 3 tests for their 5 through 11 COVID vaccinations. And I just wanted to know, what is the current state of infection rates for that demographic in West Virginia, and how important is it to the Justice Administration to, when that vaccine is administered, to get that out to that age demographic?
Dr. Marsh, this is you. Beyond my pay grade.
Thank you, Governor. Thank you, Glenn. So as of last week, we had seen a 254% increase in new cases among 0 to 18-year-olds. And certainly this is a really welcome piece of news for all of us, and certainly for parents or grandparents who are taking care of children in this age range. We know that this vaccine in Israel has been given safely, and we are really excited to hope that the FDA and the CDC approve this indication for at least Pfizer quickly. And the projections are, if all goes according to plan and all looks as good as we are hearing in the news, then by mid to late October, we may well have that eligibility as part of the approval process for Pfizer, at least for 5 to 11-year-olds.
All right, thank you, Glenn. Next to Kimberly Kagi with WSAZ.
Hi, everyone. Good afternoon. Governor Justice, this is a question specifically directed to you, but I hope that Major Hoyer can also chime in. You talked about having that meeting with state leaders this morning, and we keep hearing from all of these hospitals that they're operating at crisis level. There's a huge staff being quarantined. The West Virginia Hospital Association reported a couple of days ago, statewide, there's about 500 staff across the entire state being quarantined due to exposure of COVID-19. And these hospitals are pleading for help. As you implemented new ideas like Save Our Care, and you talk about hiring contract employees to help those hospitals, is there anything else that we can do besides implementing new ideas? How can we act?
Well, and this was Kimberly, is that correct? Kimberly, if this isn't acting, I don't really know what is. I mean, what we're doing here is we're saying, that hospitals that are overrun are still, I'm sure, trying to do elective procedures and still trying to do same day, procedures and everything. We want to absolutely let them know that we're standing in the wings and we're going to reimburse them for losses that they may have in making a choice, to move away from some level of elective care. If they can still do it or they can still do the same day stuff, that's great. But we need to absolutely make sure, without any doubt, that we make it through the next 2, 3, 4, 6 weeks. Whatever we've got to do, we think this Delta variant is peaking right now, but the fallout behind it is surely substantial, and substantial from the standpoint of more hospitalizations, more ICU units, more vents, and on and on. But Kimberly, I can tell you without any question, and I say this very, very, very proudly, through this entire time, we've kept our foot on the brake, and just, even though it may not have been just slamming the brakes on, but we've kept our foot on the brake as far as what we didn't think it was necessary to go out with full mandates all over the place and absolutely take the risk and run and get us all fragmented all to pieces. And now we are moving again with Save Our Care. Now, Kimberly, there's no absolute here. There's just not. There's no playbook. We've made the right calls, and I hope and pray that this is another one of the right calls that we've made. But we're going to do every single thing in our power to protect our people to where that they will not get in a situation to where our hospitals can't function or our nursing homes as well. But anyway, nevertheless, I think maybe you mentioned maybe General Hoyer adding some, or maybe Clay.
Governor, I think you covered it absolutely right on point.
Maybe if I could just say one more thing, Governor, that in the crisis standards when it comes to the hospital level of care, per the Centers for Disease Control, there also can be changes on the quarantining period for the staff. And remember, quarantine is really restricted in this way to people that are not vaccinated. So we, as the Hospital Association, has committed to having hospital personnel and clinical personnel be vaccinated. This crisis standard of care for some hospitals also gives them the ability to reduce or get rid of the quarantining period for the people that were exposed, because we know that spread of COVID-19 in hospital settings is really not, we have not seen that at all. They're heavily gowned and masked up in those situations. So that would be another additional opportunity for hospitals to reduce their quarantine workforce.
All right, thank you, Kimberly. Governor, I'll turn it back to you.
I've only got one thing, and I really mean this wholeheartedly. I pray multiple times every day. I truly believe that the good Lord has blessed West Virginia beyond belief. And He's blessed me, as He does every day. And He's given me the wisdom to make the right calls at the right times. They are never going to be perfect. There's no way. There is no playbook, just like I've said a bunch of times. We're moving again right now to ensure the safety of our people. That's the bottom line. But we're also moving to ensure the safety of institutions that do incredible work. Our hospitals, our nursing homes, those folks that are really on the front lines, really helping us. We have a real staffing issue. That's all there is to it. And there's all kinds of ideas on the table on how we can cure that, whether it be contracting or nursing classes or whatever it may be. But really and truly, it's a real issue. We think we're at the peak. And if we're at the peak, if we can make this another 4 to 6 weeks, or maybe only 2 to 3, things will get a lot better, a lot better. We got to step up. We got to step up right now, and we got to help our people. And for Joe, our great MMA fighter, a fighter beyond belief, a guy so strong, and his wonderful, wonderful mom. Absolutely, we're going to continue to pray for you, Joe, and you're going to make it. And you're going to get through this. And you'll have great, great, great days ahead of you. But thanks for all y'all are doing for all of us, too. We just all got to pull the rope together, and we'll get there. Thank you a bunch.